Absolutely. Well, thank you so much for inviting me on this awesome conference. It's a passion of mine, of course, like many of the excellent speakers here, to share what we are all in love with, which is plant-based nutrition, lifestyle medicine, disease prevention and reversal. Because all of us here have really recognized the massive issue, massive problem that our healthcare system has, and we need to have a solution. We have it; it's right in front of our face. It's just now, just making it happen and taking the action, spreading the word. So what I'd like to say though, with this talk today, I really want to try to see if I can, as effectively as possible, help people to really understand the problem we have in America with our healthcare system, and how lifestyle medicine is the solution so much to all of these problems. And of course, as a cardiologist, I had been practicing a lifestyle medicine approach towards cardiovascular disease now for approximately 6 years. I would like to focus a bit on that. So for those of you who are really, really into plant-based nutrition and know a lot of this stuff and have followed many of the greats, Dr. Esselstyn and Dr. Dean Ornish, Kim Williams, some of this might be a little bit of a review. I don't pretend to be an absolute pioneer in these types of things, such as the Dean Ornishes in the world. But I've learned so much from them, met with them, and experienced the absolute power that lifestyle medicine can have in preventing and reversing heart disease in my patients. So what I really see myself doing in this movement is helping just to be another person to spread the message. I stand on the shoulders of all those greats, and I'd like to get it out there so that all of you can also help to bring about change in our system, which we know we are in desperate need of doing. So with that introduction, I'm going to share my screen here and give you guys the presentation. So give me a moment. Okay, well, hopefully you guys can all see the first slide there. So we're going to talk about plant-based nutrition, preventing and reversing chronic disease. A lot of this stuff is also available on my YouTube channel. Just search my name, Stephen Lome. I need to get more active on there. I haven't put up a video in a while, but feel free to check that out. And if you want a refresher or see some of the other content that I have out there. So I'd really like to begin this whole talk kind of telling my own story a little bit, as you've already heard. So this is a picture of me about in 2014, nearly 100 pounds heavier. I was following the standard American diet, well on my way, of course, to the standard American diseases and the standard American death. I was suffering from so many different obesity-related ailments. It was just piling up, and I had my own aha moment that, oh my gosh, I really have to do something to take control of my own health. And it was really crazy. I really had this realization, I don't know what to do. I don't know nutrition. I wasn't trained in any of this. How do I really do this? And really at the same time, this is what my medical practice was all about. I was pushing pill after pill after pill, because that's how I was trained. I was trained at a phenomenal university where I learned all the biggest surgeries, procedures, diagnostic tests. But the idea of prevention there was medications. And I'll never forget the two main professors that trained me. What wonderful people they are. And I do owe them quite a bit. Great people. But they were both nearly 300 pounds and diabetic themselves. And they never once talked to their patients about weight loss, nutrition, exercising. It was just not in their mindset. And so in my mind, I'm thinking I'm getting the best university-based training here. Diet and lifestyle must not be that important, or else we'd be talking to everybody about it, right? I know it's slightly important, but come on, it can't be that profound. And so I just kept on giving patients the pills like I was taught, based on guidelines from the big places like American Heart Association, the American College of Cardiology. And I was getting frustrated. Patients didn't like the pills. They cost money. They have side effects. And even if I gave my patient all the right pills, they might still have heart attacks and strokes or need a bypass surgery, because as you guys know, the pills don't treat the cause of the underlying issue, right? The cause ends up being diet and lifestyle, but I wasn't taught that. So as I'm going along, trying to really take control of my own health, this is what I did. I made a lot of mistakes. I did what most people do when they're trying to recapture their health. thinking exercise is the key. So silly me, weighing 270 pounds, signed up for a marathon, right? That's what you're supposed to do. So I signed up for a marathon thinking if I just keep exercising like crazy, I'm going to lose all the weight because marathon runners always look thin. And no, it's not quite that easy. Of course, you can lose weight with exercise, but it's about 20% of the picture. 80% of it, for the most part, is the food part. Then the other mistake I made was reading the USDA dietary guidelines 2 times over and thinking to myself, the government's not going to lie to us, right? This has got to be legitimate stuff. So chicken and fish, low fat dairy products using olive oil. And I didn't ignore the fact that these processed foods, right? Who wants to give up processed foods? Because the guidelines still say as long as you don't, over consume and you keep the calories real low, you could still have some degree of processed foods in your diet. So I didn't eliminate them. I just ate fewer cookies and fewer donuts and went to fast food less frequently, right? And of course, I've come to learn moderation doesn't work. You should not be eating these processed unhealthy foods in moderation, just like you shouldn't be doing cocaine in moderation or heroin in moderation. Things that are bad for you really need to be 0 in your diet. And I didn't quite get that because, of course, my culture was eating all this. I grew up on this food. I didn't want to give it up. It tastes great. So it was a hard time. So I finally had the realization when Netflix said, hey, check out this thing called Forks Over Knives. And I remember watching it and just becoming, I don't know how to say it any other way, pissed off that I wasn't taught this stuff in my training. How is it that I wasn't taught to treat the cause of a person's problem? That nearly all of heart disease is preventable. Once you have it, you can even reverse it all through diet and lifestyle changes. It's not just a pill. What are all these stents we're putting in people, all these bypass surgeries? Blew my mind away. I was literally angry for a while. And it really inspired me. So I ditched the dairy. I ditched the processed foods. I changed to eating beans and lentils for protein instead of meat. I cut out the oils and have now run 10 marathons. I got down at one point to a little bit more, I believe, than 100 pounds off. And it's changed my life personally and professionally, because now I focus a lot of the a vast majority of it on diet and lifestyle discussions. And patients sometimes are a little bit weirded out by it because they're like, I've never had a doctor focus on this stuff before. Aren't you going to tell me about my medicines and the diagnostic tests and all this stuff? I'm like, no, we did all that already. Now we have like 20 minutes left. What do you eat for breakfast? What do you eat for lunch? Let's focus on this stuff. And I educate them. I pull up my PowerPoints. It has just completely changed my mindset. It's so much more rewarding when people take control of their own health. And it's so critically crazy important. So what I like to do with this talk as we go through heart disease prevention and reversal is 4 things. First, just as people know how important it is to get the message out there, how screwed up our current healthcare system is. Then we're going to do this quick crash course on nutrition, just so that you guys may know a lot of this stuff if you've been into lifestyle medicine and plant-based nutrition. But I try to have a simplified way of explaining it to people. And perhaps as you hear my way, I explain it. It'll help you to more eloquently talk to other people about it. Then I will talk about the prevention and reversal of heart disease. And lastly, give you a little bit of motivation and inspiration to go out and do things and be the change that you want to see in our system, not just for your own personal health, but for the health of everyone in America and the planet and everything. So as you know, heart disease has been the #1 cause of death in America for more than 100 consecutive years, since 1919. In 1918, it was a Spanish flu. Every year since then, heart disease, even last year, COVID was #3. So heart disease is the #1 killer. About 500,000 to 600,000 Americans every year dying from heart disease. And when you put that in perspective, it's crazy. Here is heart disease and stroke, this massive proportion of deaths. Look at war. Look at pregnancy and birth complications, murder and suicide. Now, not to downplay the importance of those other issues, but look at the perspective. What do you see on the news? Of course, you see all of these other things, but heart disease and stroke towers over all these other causes of heart disease, causes of death. So we need to focus a lot more of our attention on the heart disease and stroke prevention in the right way. And what blows my mind away is that we have a cure for heart disease. It's nearly 100% preventable and reversible. I think so. the fact that that many people died from a disease that we essentially have a cure for sitting in front of our face, that our government actively chooses to ignore, our healthcare system ignore, our culture ignores that cure, man, it just still, I can't get over it. It just blows my mind away. And of course, it's not just heart disease. Well, I'm a cardiologist. I'm not going to get into details about other things, but diabetes, hypertension, obesity, dementia, autoimmune disorders, different types of cancer, osteoporosis, all these different things. A lot of these are lifestyle related issues that are all treated best by the same approach. It's about 80% of our healthcare spending is for preventable diseases. So why do we let so many people die prematurely? Why? If we know that we can prevent these things, what is the driving force behind why we have not done more to change our food system, to change our whole healthcare system more towards a preventative approach? And I sum it up in 2 words: culture and money. And I've thought hard about this because when I was pissed after watching Forks Over Knives, I'm just like, there's got to be something I'm missing here. Why is it that this is happening? And so when you really think about it, we live in a capitalistic society. And in regards to our healthcare system, even though a lot of healthcare systems are not for profit, they still need to bring in profit to pay their bills and pay their employees and all this stuff. So when you think about a healthcare system, you said 100 years ago, let's design a healthcare system that's based on making money. Well, you're not going to want everybody like this guy, nice and healthy, right? Because there's no money in healthy people. You cannot profit off of them. And guess what? There's no money in dead people either, right? So what the healthcare system just has naturally evolved towards, because it's about profit and making money, is patients who are sick with multiple chronic diseases, needing multiple medicines and doctor visits, surgeries and procedures, admissions to the hospital. And that results in enormous expenses, enormous suffering of good people, and treatments that aren't necessarily optimal. A lot of the pills that we do and the stents and bypasses, which don't treat the cause of the problem, it is messed up. So yeah, when you look at how much we spend, it's going to be nearly $4 trillion supposedly this year in healthcare spending in the United States. And as a percentage of our GDP, the United States towers over all other countries, approaching 20% of our GDP. $4 trillion is healthcare spending. And when you compare that to other countries, it's crazy. It's crazy how little they spend compared to how much we spend as a part of our GDP. Well, you'd think with us spending so much money, we got to be a healthy country, right? Because we spend so much money on it. Absolutely not. Our life expectancy for industrialized nations, according to the World Health Organization, is dead last. It's crazy. So what's going on? We're spending all this money, but we're not living long. And so I really thought hard about my situation growing up, reaching almost 270 pounds. And my sister was 450 pounds in high school. Both my parents were over 300 pounds and diabetic. And I'm like, we just an obese family? What's going on here? What is it really that is the driving force behind how this happens? And I think to myself, was that my fault that I grew up in that way and I ended up gaining all that weight? Was it my sister's fault, my parents' fault? Well, kind of a little bit, obviously. Everybody knows you should be doing the right healthy things. But when you're really born into it, it is hard to really have that realization and that aha moment. It's really hard to make changes for so many different reasons. And so I frequently say it's not all your fault. I mean, yeah, again, a little bit maybe, but I thought that the 5 major things behind why chronic diseases in the United States are just so profound and so all over the place has to do with our human instinct, number one. And this is something that Dr. Goldhammer and Doug Lisle, the book Pleasure Trap, check it out, phenomenal book. I've learned a lot from a lot of different authors and a lot of different people, including them. It's this whole pleasure trap, the seeking pleasure, the motivational triad, avoiding pain and conserving energy. That's not the individual person's fault, that this is the way we were designed throughout evolution in order to survive and get our calories. So of course, sugar, salt, and fat taste great, not your fault, right? And then our culture. I was born into a culture where we went out for Halloween and I got this huge bag full of candy and there was no restrictions, and Halloween candy was breakfast and lunch and dinner for me for like a whole week, right? It was every birthday party, it's cakes and all this processed food. That's our culture. And when you're born into something like that, and you know that your whole childhood, and you're taught by your parents and your family and your friends and everybody else that this is the normal way to eat, Is that really your fault that you end up developing unhealthy eating habits? Not really, right? The food industry, of course, they market and market and market to us. And it's a huge, huge issue that they really don't care about the health of America. It's a business. They just want to sell their product. Our government policies are not aligned with good health, subsidizing wheat and corn and soy instead of subsidizing apples. An apple a day keeps a doctor away. What about vegetables, beans? We really need to make those healthy foods almost free for people in order to get them to eat more. And then, of course, what disappointed me the most out of this realization was our healthcare system. Why the heck was our healthcare system not stepping up and doing this? Because the science is absolutely clear. It's profound. We can annihilate these diseases. Why aren't we doing more? And again, it comes up, all these things is what makes America sick. And it's not the fault of the American people on the individual level, but you know what? Once you know this stuff and once you've learned it, then it does kind of become your fault if you don't actively make a change. What we need to do is change our system so that the food industry, the pharmaceutical industry, and our healthcare industry stops profiting from suffering and illness of people and starts profiting from good health and prevention. And there's a little bit of light at the end of the tunnel. By 2030, Medicare is supposed to be paying all doctors and hospitals for quality only, not quantity. So I hope that ends up shifting the whole mindset of healthcare systems and doctors more towards prevention. We'll see how it goes. But culture and money, that's what it is. We've chosen these two things over health, and it's so sad. What we really need is a paradigm shift away from pills and towards plants, away from just throwing prescriptions at people and doing surgeries, and more towards prevention. Because right now with this acute care model that we have, you get 15 minutes to see your doc frequently. And you only see the doctor. You don't see a nutritionist or a psychologist or anybody else. We don't get paid for prevention. Many surveys show preventative medicine doctors are dead last in salary in regards to physicians in the United States. So of course, lifestyle is not adequately discussed. Western medicine is, here's the pills and the procedures you need first. Oh, good luck eating healthy, losing weight. And that's why I love lifestyle medicine. Lifestyle medicine is the opposite. It's let's focus on the diet and the lifestyle first. And if we have no choice, then we do have medications that we could fall back on and procedures we can fall back on. But the primary treatment in lifestyle medicine is eating healthy, exercising, losing weight, stress reduction, sleeping good, avoiding alcohol, all those things. So in a new system, you need a long appointment with an integrative approach, getting paid to keep patients healthy instead of for seeing more patients, and focus on lifestyle. That's really what we need to do, because more studies after studies after studies are simply showing that putting stents in coronary arteries do not make people live longer, doesn't prevent heart attacks. And there are complications with these things too, right? So this is a big trial called the ischemia trial, where they took people who had blockages that affected a moderate to sometimes large portion of their heart muscle. They randomized them to getting a stent put in versus medical therapy. There was no difference in death long-term after 5 years. And if anything, there was a trend towards conservative management with medications and diet and lifestyle being superior to putting a stent in. A stent doesn't treat the cause of the problem. And so when I thought about this, I was sending so many people for these procedures left and right. That's the way I was trained. When you really look at it, so coronary stents, about 1.2 million per year. About 1% of people die during that procedure. So when you do the math, that's like 12,000 people you just killed putting stents in, right? And then what about like other complications, not just death? Well, actually the stents can induce heart attacks sometimes, about 4% risk of actually causing a heart attack during the stent procedure. That's 48,000 heart attacks caused every year by stent placement. Then you go through bypass surgery. Think about bypass surgery, sawing the chest open, taking veins out of the legs. What a huge, extensive procedure. At 3% mortality, that's about 15,000 deaths per year from complications of bypass surgery, not to mention 15,000 strokes, which are devastating. So what about complications of lifestyle medicine, a lifestyle medicine approach? Guess what? Nobody dies from that, right? Nobody dies from eating fruits and vegetables, beans, lentils, whole grains. It doesn't cause a stroke, doesn't cause a heart attack, just the opposite. It helps to prevent it. It's cheap. It works. We need to make our system promote this and have it happen for every patient that needs it. So that's the whole state of our healthcare system. We know the solution is just making the change happen is the key, getting the message out there, getting the money in the right place. And I have some hope that through conferences like these and other advocates that we're going to make that change. It's been a long road, but I hope we're getting there. So let's talk a little bit more about heart disease. Let's shift it, and let's talk about some of our friends here. Let's talk about the monkey and the rabbit. And now, of course, I don't condone any animal experimentation, but there is some things to learn based on what's been done in the past in regards to heart disease. We think about monkeys out in nature. They're eating their bananas, rabbits are eating their carrots, they're all physically active, eating their plant-based diet, which their body was designed for. They're not smoking cigarettes out in nature. At least I haven't seen a smoking rabbit or monkey anywhere, right? And guess what? In nature, their arteries are completely clean. They don't develop any atherosclerosis. They don't have heart attacks. They don't have strokes. That's not a natural thing for them, right? But if you take these animals and bring them into a laboratory and feed them diets high in cholesterol and saturated fat, within about 6 months, guess what happens? You clog the animals up. The arteries get blocked with cholesterol plaque, and they do their experiments that they want to do to see what they can do to stabilize it or trigger a heart attack or whatever. It's horrible. Again, I don't condone that. But we know that this is the model that's been developed to study heart disease, where you take an animal that's a natural herbivore, feed it an animal-based diet, high in cholesterol and saturated fat, and watch the plaque build up rapidly. Here's what's also super important for us to realize, that if you take these animals that were artificially clogged with the diet high in cholesterol and saturated fat, and you put them back out in nature, you give them back their bananas and carrots, let them stay physically active, guess what happens? Their natural healing mechanisms kick in, the plaque reverses itself, and it's just absolutely amazing. And so this is such a simple thing. And the simple core concept of lifestyle medicine is that the default state of the human body is to be healthy, right? The body doesn't want to clog its arteries. It doesn't want high blood pressure, high cholesterol, it doesn't want type 2 diabetes. It doesn't want to become obese. It only does so if we actively do something that harms our body. And it's crazy to think that it's that simple, but it is. Just stop harming yourself and it will improve. And so the analogy I use is if you cut your hand with a knife and you do nothing, you see the blood stop, the bleeding stop, the scab form, and the scar develops over 3 or 4 weeks. But if you keep on cutting your hand in that same spot every single day for decades and decades and decades, then it never heals. You keep injuring it. Well, our arteries on the inside are really no different than our skin on the outside. And we continuously injure our arteries through the food we eat and other things like tobacco or secondhand smoke. So it's just a basic concept. It's so important and so powerful. Now, the whole little crash course on nutrition, we're going to go through here. And again, many of you may know this, but this is, I think, the best way to explain it in order to get your message across to people. I say, hey, listen, let's simplify things. Whatever you call the diet you want to follow, let's just think about what is in your diet in these 3 groups. The first group is processed foods. And what does processed foods consist of? Ingredient-wise, it's anything that has sugar, white flour, or added fats, not just olive oil, but added fats, any type of shortening, any other types of oils that are in there. So sugar, white flour, and added fats, that's processed foods. That's the first category. Second category, animal-based foods. Of course, meat, eggs, dairy products, seafood. That's where cholesterol and saturated fat comes from, which we'll show in just a moment. The third category is whole, unprocessed, plant-based foods. So really, what we need to do with a healthy diet is eliminate those processed foods. They just need to be gone, not reduce them, not moderation, right? Just like, again, you shouldn't do cocaine and heroin in moderation. Processed foods should be out. And it's amazing to know, and this actually blew my mind away when I first learned this a few years ago after watching Forks Over Knives and reading a lot of nutrition. We don't need the animal-based foods. I couldn't believe it, but we don't need the animal-based foods. We need to focus on whole, unprocessed, plant-based foods, a whole food, plant-based diet, which is what everybody here advocates strongly. And so, what I always think about when I used to look at my refrigerator and it was all full of these dead animals and their secretions and all this stuff, it looks kind of gory now when you really think about it. When I've given up these foods and I don't even see them as being foods anymore, it just doesn't look good. And then when you think about what the fridge looks like now, beautiful, colorful, amazing. This is why we see in colors so that we can be attracted to these foods. It's mind blowing that it isn't just such an obvious thing to begin with, right? And man, the food is just so amazing with over 200,000 edible plant species. I really just break it down to the simple fact that we need to focus on these fruits and vegetables, beans and legumes, lentils, whole grains. And there's so many different types of whole grains. There's dozens of different types of whole grains, nuts and seeds, herbs and spices. And when people look at this, they kind of go, wow, can you really make good, healthy, tasty food with this? Yeah, well, yeah, you could make such phenomenal. That's not really my expertise. I was on a panel yesterday with Chef AJ, who just can make this taste so phenomenal in so many different ways. Check out her site, pbnm.org, has a resource section with tons of recipes and other things that can help you figure out how to take this and make it into just phenomenal food that'll sustain you and help you get your natural healing mechanisms kicked in to reverse your diseases. So I do emphasize the one thing, though. We need to know what is a whole food. And when I used to work out in the Chicago area, I would always shake my head. I would drive by this donut store, and they would say, they had a sign out there that said, eat whole foods, HOLE. No, that's not what I'm talking about. Not donut holes, right? Ridiculous that like society mocks this whole concept of trying to eat healthy, but that's the way it is. And of course, there's a line out the door to buy the donut holes, right? We're talking about a food is a whole food if no harmful component is added to it, like you're not adding sugar, you're not adding oils, things like that, and no healthful component is removed. You're not removing the fiber, you're not removing any of the good nutrients. So you want it to be unprocessed or minimally processed as much as you can. Of course, like whole wheat pasta is processed a little bit, and those types of foods are okay to do as long as they try to like not do massive quantities all the time. And I always emphasize the difference between vegan and whole food plant-based. Sometimes I say whole food vegan. These things, I have patients all the time. If I say just plant-based, they might be 70% plant-based and still eat meat, eggs, and dairy. So I don't use the word plant-based. I either say 100% plant-based or whole food vegan. But when people think of vegan and they see the vegan label, they think of these foods, Beyond Meats and cereals and things like that, the tofurkey, all these processed foods, heavy in oil, heavy in salt, and a lot of sugar added to these things, right? That's not what we're focusing on. We're focusing on whole food, plant-based, whole food vegan, and you can make the food spectacular: burgers, pastas, everything, pizzas, you name it. It's phenomenal. So that's a little crash course on nutrition. Now, getting back to heart disease. Why is it so important to do this stuff? Why is it so important to really focus on being healthy right now, no matter what your age is, no matter where you are with your health? Because atherosclerosis, heart disease, the clogging of any of the arteries, is a disease that starts early. The day you're born, your arteries are wide open, nice and clean. But as young as the age of 3, we start seeing fatty streaks building up in the arteries of the heart. And it's crazy. There was even one study that showed pregnant women who have massive cholesterol disorders, whether cholesterol numbers or LDLs are 300 to 400, in the fetus, they can detect fatty streaks in their arteries already building up in the mother's belly before the baby's even born. Atherosclerosis starts early. So the earlier you're doing all the right healthy things to protect your arteries, which we're going to get to, the better you're going to be. It slowly progresses over time. In the adolescence and into adulthood, you can, severely clog your arteries. But the big thing that we don't want is when that blood clot forms, suddenly, you could be fine one day, you could run 10 miles and everything's all right. And then suddenly that blood clot can form on an unstable plaque. It becomes ulcerated and your body thinks it's doing a good job healing up. It's like cutting yourself with a knife. It clots the blood thinking there's an injury, right? Well, your body thinks there's an injury on the inside of your artery. It doesn't know any different. It just thinks it's healing, and it clots it off, obstructs the blood flow, boom, and you get a heart attack. So why is it important? I could just, once I get the heart attack, fine, then I'll start eating healthy, right? Nope, guess what? The first symptom in 1 out of 3 people with heart disease, the first symptom is they just die, sudden death, the first symptom. So you got to start early to prevent heart disease. The earlier, the better. So there are a lot of nuances in regards to heart disease prevention, but more than 90% of it can be summed up by 2 things. One is controlling your blood cholesterol levels. And the second is protecting your endothelium, the lining of the arteries, protecting it at all costs. So these are the two things that people really need to focus on for heart disease prevention and eventually reversal when you take it all the way to that level. So let's go into these two things just a little bit. So in regards to cholesterol, it is just so crazy important. There's a great article that goes over the importance of cholesterol. There's all these risk factors for developing heart disease, but which one is a prerequisite? Which one is necessary for you to clog your arteries up with cholesterol plaque? Only having an elevated cholesterol is a prerequisite. So if you phrase this a different way, in other words, if your cholesterol levels are really low, there is no evidence that smoking cigarettes, having high blood pressure, being diabetic, being a couch potato, or being morbidly obese will clog your arteries up with plaque. So the prerequisite is getting that LDL crazy low. There's interesting studies on people with genetic mutations in their different, CETP, different enzymes and such that have an LDL cholesterol sitting around 60 from the day they're born, no matter what they eat. And they could be obese, diabetic, and smoke, and they don't have heart attacks and strokes. Their LDL was 60 from the day they were born. So the sooner you get it down, the better you're going to be, which I'll show you in the future in a slide coming up here. So what can you do in the diet that lowers your cholesterol? Well, it's three things. Dietary cholesterol, if you eat it, it'll raise your cholesterol up. Saturated fats will raise it up, and trans fats will raise it up. Those three. Trans fats are illegal now to add to foods, federal law, but it is still naturally occurring in many different animal-based foods. So if you go on a whole food plant-based diet, now you've eliminated cholesterol, you've essentially eliminated most saturated fats and trans fats. That's what you need to do to halt and reverse heart disease. Knowing your cholesterol numbers is so critical. You need to know it. Now, this is the standard numbers that you'll hear a lot of people say. Keep the total cholesterol under 200, the LDL under 100, the HDL, the higher the better, and then the triglycerides less than 150. But is this right? Is this the right numbers that we really need to be focusing on? Well, let's answer that question. Big study, Framingham Heart Study, which went over all these people in Framingham, Massachusetts, followed them for a long time, got all their different information. Guess what? About a third of heart attacks happened in patients who had normal cholesterol levels, but their normal was perhaps not low enough. What we do know is there's this great publication in the Journal of the American College of Cardiology, probably arguably the most prestigious cardiology journal that's out there, that did a phenomenal job of explaining how LDL impacts your cardiovascular health and how the sooner you control your LDL cholesterol, the better you're going to be. And so here's a graph, and follow me through this here. It's so important to understand about your cumulative LDL cholesterol exposure. Some people call this plaque years. In the medical world, we have an expression for when people smoke cigarettes, 1 pack of cigarettes per day times 20 years is 20 pack years. Well, this is plaque years. And so the longer your LDL is high, the higher your risk is going to be for having an event like a heart attack or clogging your arteries up. So the average American, their LDL cholesterol sits at 125. The average American, by the age of 40, 1% chance of a heart attack if that's where you are. By the age of 60, 4% chance. And by the age of 80, there's a 16% chance that you will have had a heart attack if your LDL cholesterol has been the average, which is 125. Now, I have people coming in with LDLs over 200 all the time, but let's use the next number and let's just call it 160 LDL cholesterol. And let's see where that falls on this graph. Well, if you have an LDL of 160 on average, by the age of 40, you're at a 3% risk of a heart attack. By the age of 60, you're at a 16% risk of a heart attack. By the age of 80, you're off the charts in regards to your risk of having a heart attack, probably around 50% or so, right? Now, let's take it the other way. If your LDL cholesterol remains nice and low, let's say 60, by the age of 40, your risk is way under 1%. By the age of 60, still way under 1%. By the age of 80, your risk is still way under 1%. What a powerful thing just with LDL cholesterol control. So that was a great publication, and I think that really does a really powerful job of explaining the cumulative LDL exposure. The sooner you get it down, the better you're going to be. So we know some of this information from nutritionfacts.org, Dr. Michael Greger, love him, check it out, How Not to Die. Great chapter on how not to die from heart disease. We know that the normal LDL should be between 50 and 70. And we know that neonates, are even lower when they're born, and healthy adult primates, their LDL should be between 40 and 80. So what's the heck with that less than 100 number that we usually saw? Well, that's not right. It should be lower, right? So here's a great publication that showed what we call primary prevention, trying to prevent the first heart attack, first stroke. And all these dots are actually clinical trials where they're using cholesterol, looking at events. For primary prevention, the LDL cholesterol where events approach zero is around 55. Now, what if you've already had a heart attack or a stroke? This is secondary prevention clinical trials. If you want to get your risk to close to zero after you've already had an event, the LDL needs to approach 30. It's crazy low. I mean, nobody ever tries to push it down to as low as 30, right? Well, there's suggestion that could be beneficial. So maybe we should change our ideal cholesterol numbers. It shouldn't be less than 200 for total. It should be less than 150. The LDL should be less than 70. Don't worry about the HDL. It's more the function of the HDL and the triglycerides. Sure, less than 150 sounds good, but that's a whole different discussion. So just to breeze through now, we said cholesterol, saturated fat, and trans fats are the biggest things here, right? So where does cholesterol come from in the diet? Of course, we know animal-based foods. It's not an essential nutrient. You don't need to eat any cholesterol to live. Every cell in your body can make cholesterol for you. And plant-based foods have absolutely no cholesterol. Many of you know that. So focus on the unprocessed plant-based foods. Many people don't know chicken and eggs are the number 1 and number 2 source of cholesterol in the American diet. In most surveys, beef is relatively high. People think I eliminated red meat, so I'm okay eating chicken, right? Nope, you're still going to have a lot of cholesterol in that chicken that you're eating, maybe less saturated fat, but you're still gonna have a lot of cholesterol in that. Every time people think I'm eating healthy, right? I'm eating chicken and fish. No. Cut the chicken out, definitely, no question. Even the fish has a significant cholesterol and some saturated fat content. Of course, butter is high in cholesterol, and look at the plant-based foods, none. Plant-based foods don't make cholesterol. Should we eat any cholesterol? So here's a statement. In the USDA dietary guidelines, which are flawed, the science is good, but their general end recommendations in the end are wrong in regards to their plate, which I'll show you. Here's a statement that they say, as recommended by the Institute of Medicine, which has since changed its name, individuals should eat as little dietary cholesterol as possible while consuming a healthy eating pattern. As little as possible. Well, that's zero, right? It should be zero. Zero cholesterol, please. So in regards to saturated fat is fat that is probably more important than dietary cholesterol in regards to your LDL. Butter is very high. Cheese is the number 1 source of saturated fat in most people's diet here in America. Beef is very high in saturated fat, and that's one of the reasons why red meat has such a bad rap, that and the cancer risk, of course. Chicken is lower in saturated fat, and that's why, chicken's a little bit better for me, right? Well, it still has cancer risk, and it still has a ton of cholesterol in it, and it still has some saturated fat, right? It might not be a huge amount, but it still has some. And look at the coconut oil and the palm oil, extraordinarily high amount of saturated fats. And no, plant-based saturated fats are not necessarily any dramatically different. They're still harmful to your health. And look at the plant-based foods, essentially no saturated fats in the plant-based foods, right? So here's the statement about cholesterol, about trans fats, saturated fat, and cholesterol in the diet. The Institute of Medicine did not set an upper limit, how much is safe for you to eat in regards to cholesterol and saturated fat, because any amount that you eat, any amount above zero, any bit, will raise your LDL cholesterol number. We know this based on what's called controlled feeding studies, where they locked people in, controlled everything they ate, and then monitored their cholesterol numbers. And we know that any amount of saturated fat, dietary cholesterol, and trans fats will raise your LDL. So when people are trying to change their diet to get their LDL down, they should go to zero for all these things and see how far you can get it down to begin with. And it's similar to smoking cigarettes, right? You don't need to smoke cigarettes to live. Any amount of cigarettes is going to cause harm to your health, any amount. So it should be zero. You don't need to eat cholesterol to live. You don't need to eat saturated fat to live. It should be zero in your diet. So that is drilling in the point of how important LDL cholesterol control is and how you can get it down with diet. Eliminate cholesterol, dramatically reduce saturated fat as much as you can. And of course, the trans fats come down as you eliminate the animal-based foods. Let's now move to protecting the endothelium, the lining of the artery of the heart. It is so important, the lining of all the arteries is so important to keep that protected. And it can be fragile. And this is part of where the genetic component I explain to patients comes in with heart disease. You say, oh, heart disease is genetic in my family, right? Well, it's like, well, some people are born with their endothelium simply being more fragile than other people, right? Some people can smoke cigarettes like crazy and they don't clog their arteries too much. Other people, just a little bit, boom, they're causing inflammation and damage to their endothelium. And so there's many different genetic factors that really play a role there. But if you took excellent care of your endothelium, even if you have that genetically fragile endothelium, you still can prevent the heart disease from developing. You can prevent those events from happening. So in regards to the endothelium and the plaque buildup process, it's an inflammatory process. Inflammation. Look at the word, inflammation. What is it? Inflame, right? So basically your arteries are on fire. So here's the analogy. I really like to think about it. You would never want to do anything to pour gas on the fire. Why would you fuel the flame and make the inflammation worse? So what kind of things do that? Of course, animal products, specially processed meats and the higher fat animal products, oils, technically of any kind. You can make arguments that some are less harmful than others for sure, but they're highly processed. Refined carbohydrate, sugar, white flour. The caffeine thing goes back and forth. I know Caldwell Esselstyn really thinks caffeine can impair endothelial function based on brachial artery tourniquet tests and such, saturated fats, and of course, tobacco and smoke. That's what pours fuel, pours gas on the flame. You don't want that. So what is it that pours water on the flame? What can help put out the inflammation? Of course, unprocessed plant-based foods. You knew I was going to say that, didn't you? So fruits and vegetables, beans and lentils, whole grains, herbs and spices, more than 100,000 edible species, probably 200,000 edible species of unprocessed plant-based foods. So what do? Do we just keep eating more of these unprocessed plant-based foods and trying to pour more water on the fire as gas is also being poured on the fire? No, just like we said, remove the thing that's causing the harm, right? Remove the thing that's causing the harm. And then what's going to happen? Now you're only pouring water on the flame and the fire gets put out. You know, how simple is that? That is the concept of lifestyle medicine. And it works, which I'll show you some of the clinical trials. But to damage that endothelium, it really only takes one meal. We know this. This is a picture from the Game Changers documentary where they had them, they had some people, some athletes, I believe it was Miami Dolphins wide receivers, eat a meal, and the one guy eats an avocado bean burrito, and the other person it's like a organic grass-fed chicken burrito. I don't know exactly what it was, something like that. And they drew the blood and they just looked at it. On the left side, a lower fat plant-based meal with healthy fats. It wasn't even that low fat. It had healthy fats that were plant-based in it. The blood is nice and clear versus the high fat is nice and not nice. It's horribly and cloudy. And that circulates throughout the body after breakfast, lunch, and dinner, causes endothelial injury, makes the cholesterol numbers go up. And that is just not good. Even one meal. So you can imagine what decades of meals like that would do. So it's a cholesterol, lower that down, and it's endothelial health. So I like to emphasize something that Dr. Michael Greger also puts in his initial talk, How Not to Die, and that is simply this statement, that heart disease is not the cause of death. Wait, I just lied to you, didn't I? Because I told you earlier, heart disease is the #1 killer in America, right? Well, you know what? I guess I did lie to you, because the #1 cause of death in the United States is the American diet, right? Dietary risks. This is the burden of disease study that really has tried to show what can we do, what can we impact in order to end up lowering risk. It's dietary. Dietary factors are the #1 thing. Tobacco is #2. So why is it that we really haven't done anything? Why haven't doctors done this? And again, it just blows my mind the way that we haven't made enough changes. And then the analogy that Dr. Greger likes to use and other people as well is so powerful. When we really think back to the 50s and 60s, we think of how doctors used to smoke. You go to medical conferences, it would be a haze of smoke. Pregnant people used to smoke, and it was just all over the place. And it's crazy, horrible how this was promoted. There was science that showed it was okay. Nowadays, it is not the tobacco, it's the food, right? But I go to a journal club when I was training, and what do they buy us? Pepperoni pizza, soda pop, and potato chips. That's what the cardiology trainees are eating as they're discussing research journals. And now I go to other conferences, and it's still, there's red meat all over the place. There is so many animal-based foods and even processed foods. Now it's the food is the problem. And the food industry has done the same thing the tobacco industry did back then in regards to brainwashing us, funding studies, making things confusing, trying to keep it as a part of our culture. And the sad state of our health is really this, that 63% of calories come from sugar, white flour, and added fats, the added oils. That processed food categories, remember when I had those 3 food categories in the upper left was processed foods? That's 63% of the calories in America. And then the upper right corner was the animal-based foods. That is 25% of what Americans eat. And Americans, according to the USDA, only eat 12% of their calories from unprocessed plant-based foods. And half of that is potatoes from French fries and tomatoes from ketchup. That's horrible, horrible. So what we really need to do is eliminate that yellow part completely. Knock that red part down to as close to zero as you could possibly get it. And then, of course, that should be a predominantly green pie graph. And so the concept that I really emphasize in all of my lectures and when I'm talking to patients is the simple percentage of calories that you get from unprocessed plant-based foods, which is what exactly this pie chart shows. You need it to be at least 90% to be healthy. But of course, we really want it to be 100% if we can. So when people are extremely resistant to the whole 100% mindset, I tell people a Mediterranean diet is historically at 90% at least. The DASH diet is 90%. They're all plant-based diets. It's just they're not quite 100%. So if they're really resistant, then I'll say, fine, get on the Mediterranean diet, make sure you're 90% whole food plant-based. Then we'll work on that other 10% as you go. And we get there. But anything that a patient can do to increase the green part of this pie graph is going to make them healthier. And it's important that this is probably the most important concept that I discuss with my patients. So on the left is a USDA plate with 3 servings of low-fat dairy. And they say fruits and vegetables should be half. That's great. Grains, they don't specify whole grains. They don't say it all has to be whole grains, which is just bonkers. And they say protein. Well, protein is not a food, right? Protein is a macronutrient. We need to really say that it should be legumes, beans and lentils, other plant-based protein sources. So on the right is what PCRM really advocates, that type of plate where you're drinking water. Canada's food guide, markedly better. It does have half fruits and vegetables, and it says to emphasize plant proteins more often than animal proteins. It's not perfect. As you see, there's eggs and salmon on there, but it is much better. And so when I tell people how messed up the USDA dietary guidelines are, I point them towards Canada's dietary guidelines where dairy has been removed as a food group, and it's 90% or more plant-based. So to emphasize, eat the whole food, eat the orange, not the orange juice, eat the olive, not the olive oil, and don't worry about the whole protein thing. You're going to be fine as long as you're eating adequate calories of unprocessed plant-based foods. You're going to blow protein away. Just make sure you're eating a variety of foods. Don't eat only bananas. If you eat only bananas, 20 bananas a day, okay, fine, you'll get 2,000 calories, but you only get 20 grams of protein. Not enough. I get it. Make it a variety, right? And whenever somebody argues about this can't be right, what about protein? What about this? What about that mineral? Well, just say, hey, listen. The American Academy of Nutrition and Dietetics has a statement, and they say that a 100% plant-based diet, as long as it's well-balanced, again, is nutritionally adequate for all stages of life, including childhood, infancy, pregnancy, adolescence, elderly people. My wife had two babies conceived and born, 100% plant-based. We have 6 plant-based children. They are thriving, athletic, strong, growing great, and very smart. They have no problems whatsoever. So this statement just knocks out anybody's doubt that you can't get this or you can't get that or whatever. It is nutritionally adequate. And of course, you could ask all these plant-based athletes, and you've probably seen The Game Changers, which I refer all my patients to. Phenomenal documentary. Now, let's focus a little bit more on heart disease. Nathan Pritikin. I love this quote. All I'm trying to do is wipe out heart disease, diabetes, hypertension, and obesity. That's it. Nothing more than that. Nathan Pritikin's story, many of you may have heard his name, but may not be as familiar with his story. He said, he developed chest pain, angina, coronary disease. And he knew the studies, the monkey and the rabbit thing, and cultures out in the middle of rural Africa and China who ate plant-based, ate active. They didn't develop heart disease. So he started the Pritikin program. And what he did was he said, hey, let's eat plant-based, let's do this. And he showed clinically you could reverse heart disease. And he had guts. He said, when I die, I want my autopsy to be published in the New England Journal of Medicine. And he had pre-existing leukemia before he changed. He died of leukemia. And his autopsy showed the near absence of atherosclerosis. And the pathologist commented that its complete absence of its effects, meaning no heart attack, stroke, or any vascular occlusion, was absolutely remarkable in somebody who had been diagnosed with heart disease. However, he was following his program for many, many years, right? It takes decades to develop the plaque. It's going to take decades to make it all go away. And so Dean Ornish is one of the founding fathers of the whole concept of lifestyle medicine and heart disease reversal, published a lifestyle heart trial 1990, showing that people who followed whole food plant-based and other lifestyle changes had their blockages regress. They said that after 1 year, the blockages that averaged 61% went down to 56% in 1 year. That's crazy. And that is without using cholesterol medicines, right? And so he basically concluded that comprehensive lifestyle changes may be able to bring about regression of even severe clogging of the arteries after 1 year without medications. Followed it up with a 5-year study where they did angiograms again. This is an invasive procedure, so probably never be done again. They did angiograms, and after 5 years, there was even more regression of atherosclerosis in 5 years. And then the control group who did not follow this program, the clogging progressed and got worse. What's even more bonkers is we can see within just weeks of changing the diet, not only do we experience that the patient's chest pain frequently resolves, but we see this in our testing. On the left side is a nuclear perfusion scan, where you put a tracer in the person, it gets taken up by the heart, and you can see the blood flow. In the upper left is before treatment. There was no blood flow getting to that segment of the heart, just changing diet. What happens? Boom, it fills in, the blood flow improves, no stent was put in, no bypass was done, just the diet was changed, and the blood flow dramatically improved after just 3 weeks. And then on the right is one that Dr. Esselstyn loves to show of a patient who had a severe, we would call this a ratty, diffuse, left anterior descending widowmaker stenosis. And with just diet changes, it reversed itself. And this was the next angiogram was done 32 months later. That just happened to be when it was he had recurrent chest pain and they checked him again. So crazy powerful. And this has kind of resulted in the guidelines, the primary prevention guidelines from the American College of Cardiology, really just saying straight out, plant-based diets are the preferred dietary approach. So if anybody ever says, what about this diet? What about that diet? Blah, 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 just say, listen, heart disease is the #1 killer. The American College of Cardiology, the American Heart Association guidelines for the prevention of heart disease recommend plant-based diets. They say pro-vegetarian Mediterranean style diets. Mediterranean is not enough to prevent heart disease. You need to make it a almost complete vegetarian Mediterranean style diet. And of course, the closer to 100% you get, the better you're going to be. Somebody who inspired me dramatically, and I worked with them at Rush for a few years, didn't get some of the programs done that we wanted to do, which made me move out more to the California area where I'm doing a lot of other lifestyle medicine things, was Dr. Kim Williams. I wanted to share a couple of his quotes because I just think they are so powerful. And it's important for people to know. He basically said straight out, a whole food plant-based diet is a cure for heart disease. If you're a cardiologist and you don't tell your patient about the cure for their disease, that is medical malpractice because you are actively withholding a cure from your patient. And you cannot do that. You cannot withhold a cure from your patient. And then, of course, his other famous statement, which you probably heard over and over again, is that there are 2 types of cardiologists, vegans and those who have not yet read the data. And the reason he said that is because most cardiologists don't read the nutrition data. They read the data on medications and stents and bypasses and all those diagnostic tests, but they don't emphasize nutrition. The nutrition data is not published in the cardiology journals. It needs to be in front of everybody. And there's really, once you read it, there's no going back. It is so powerful that this is what we need to be doing. And we did take this Hippocratic oath, right? First, do no harm. That's what doctors took Hippocrates said, let the food be thy medicine and let the medicine be thy food. Well, we are doing harm if we're not actively spreading this message of a healthy lifestyle and plant-based nutrition as the primary treatment for all these lifestyle-related disorders. So I always say that the one thing that you can get out of this, that you can understand, is that you individually have the power to save other people's lives, which is awesome, right? Even if you're not a doctor or nurse in the healthcare field, with this knowledge that you have, you can save people's lives. Yeah, focus on your own health. You need to be healthy yourself to be able to be an advocate for a healthy lifestyle. But remember, you are the change. Speak up, demand the change. Politicians are just going to support where the money is unless people speak up. So be a good example, spread the word. You have the power to save other people's lives. And I do think together with conferences like this, with more and more doctors getting board certified in lifestyle medicine, with social media, these great documentaries that are coming out, the Game Changers, Forks Over Knives, What the Health, all these different things, we are going to make that change. We just need to never give up and keep going, because change takes time, and it sucks that change takes time, but it does. And we need to push it forward as fast as we possibly can. We want to shift our whole system away from pills to plants, of course, right? From the pharmacy to the pharmacy. And I always emphasize at the end of my presentations, just to give people some extra motivation, because there's one thing to know all this stuff, that you should be eating whole food, plant-based. It's another thing actually doing it. I get it. Behavior change is tough. There's a lot of barriers that people have, their culture, the people at their house, their food habits, their dietary preferences, things that they're used to eating. It's hard to get that extra motivation. When I have a patient who wants to eat whole food, plant-based, but is still struggling to do so, this quote is helpful. And I'm going to show you some other slides that support this. The most ethical diet, ethical in regards to not causing harm to other beings, right? Just so happens to be the most environmentally sound diet, best for climate change. And it happens to be the healthiest. That is a very true, powerful statement. And so I remember I was at a lifestyle medicine conference once, and there was a pulmonologist talking about smoking and all these things. And he said, listen, man, when I have somebody who wants to stop smoking and they're having a hard time quitting, even though they want to, I pull up all these pictures of charred lungs and lung tumors and people with tracheostomies and all these gory things, because once they see it, they can't unsee it, right? And so if somebody needs to ditch animal products, and they know they need to ditch animal products, and they want to ditch animal products, I tell them that you need to really understand what animal agriculture is like in America. It's absolutely horrible. You need to make yourself watch what it's like. Check out the documentary Dominion. It's free on YouTube. And if you watch that and still haven't reduced your animal products, I don't know what else to say. It is a very powerful documentary. Think about how cute pigs are. My daughter, she loves pigs. Why would you ever want to eat your friends? Pigs are our friends, right? And then check out the documentary Cowspiracy. Talks all about how climate change is so crazy and driven by animal agriculture. Many people argue the number one cause of climate change is animal agriculture for so many different reasons: species extinction, deforestation, ocean dead zones, freshwater usage. And there are so many studies that really show that the food system is the major driver of climate change. Plant-based diets are the solution. This was a big study published in Nature, that meat consumption needs to be reduced by 90% in order for us to achieve our climate targets. And according to the United Nations Intergovernmental Panel on Climate Change, a vegan diet, we'd like to say whole food, plant-based, is the best dietary pattern to reduce carbon emissions. These are some pictures from the Plant Nutrition Project. Dr. Scott Stoll tells a powerful story about how important all this is. On the standard American diet, you can feed one person. It takes about 2 football fields in order to grow enough food on a standard American diet. But on the right, on a plant-based diet, 2 football fields can feed 14 people per year, 14 times more people. So when you think about how many acres of land or football fields of land that we would be able to free up in order to, if everybody went on a plant-based diet, it's 5 billion football fields we would be able to free up if we just went on a plant-based diet. We could return it to its natural habitat, use it for so many other things. It's mind-blowing. And water, 12,000 gallons of water. It's enough for a family of 4 for a year, but 12,000 gallons of water is only 10 pounds of beef. That's it. So cut out the beef. You have enough water for people so much. And we're going to have a water shortage out in California. There's droughts all the time. We need to cut out the animal foods to help with the water. And we know Brazil is the world's largest beef exporter. Eating meat is linked to the Amazon fires, right? They clear the rainforest with fire frequently in order to grow crops to feed to livestock and to graze livestock. It's destroying our natural carbon sequestrants, the rainforest. We really need to stop all this stuff. So just to finish off, almost done with just some quotes. Nothing will benefit human health and the increases of chances for survival of life on Earth as much as the evolution of a vegetarian diet. Back then, they didn't use the word vegan. Of course, vegan would make sense. Good old Albert Einstein, who also said that those who have the privilege to know have the duty to act. So once people know this and it presented, the blinders are taken off, right? Because a lot of people live their lives with these blinders on, doing what their culture does, eating what tastes good to them, what's convenient, what's cheap, what's their habit. But once those blinders are off, it's now your fault if you don't make change. And it's also, honestly, taking it to the next level, really, you're almost obligated to spread this word, really push it in order to get other people to understand these concepts and eat more plant-based. And we are kind of going through this. All truth does pass through 3 stages. First is ridiculed. And it was massively ridiculed for the longest time, eating plant-based diets. But now it's pretty well accepted that this is the right things to do. But there are still many people who violently oppose it. Look at all these people on YouTube, these crazy YouTubers about keto diets and carnivore diets and all these other things that are out there. They are opposing it. They're saying this is wrong. And they just, don't want to admit that what they've been doing has been causing harm. But eventually, it's accepted as being self-evident because the science doesn't lie. The science is very, very strong. And we're getting close to that 3rd stage. We're going to be there hopefully pretty soon. So a lot of this stuff, check out my YouTube channel. I have lots of different YouTube videos kind of explaining how to do a vegan diet the right way, how to balance right, preventing and reversing heart disease, losing weight, all about oil. Check it out. And feel free to send me messages. I'm on social media, Twitter, Facebook, all those things. And I believe I'm going to stop sharing now, and we're going to open it up to some questions. I hope you guys learned something and enjoyed the presentation. Here we go.
Dr. Lome, thank you so much. This is Ben from The Real Truth About Health. Just so meaningful, everything you shared today. And like you, we hope it landed with everybody. I know it landed with me personally. And thank you. Thank you so much for that. You did just show your contact info. Anywhere else folks can get a hold of you? Is that the best place, your YouTube channel, or what else do you want to share?
YouTube's great. Heartstrong.com is one of the websites that I do. pbnm.org was a big nonprofit organization I founded in the Chicago area when I was at Rush. And thousands of members, still very active. There's great resources on that website. I'm not as actively involved anymore with them, but they're still going strong. Social media, Dr. Stephen Lome on Facebook, at Steve Lome on Twitter. I'm on Instagram, although I'm not very active with that stuff. And then, of course, if you just Google search my name and Monterey, California, you'll find my clinic website with Montage Medical Group in Monterey, California. I can do telemedicine with anybody in the state of California, but my license is restricted to California only, which kind of sucks. Thinking about changing that. So.
Excellent. Thank you for sharing all of that. And so with that, we're excited to have a little Q&A with you. So thank you in advance. And I just want to make sure I explain this to our audience for those that are joining us for the first time, and you'll get to see how we do this as well. We typically do not take questions directly from the chat box. What we do is we ask people to raise their hands virtually. And so I see a couple of people have already begun to do that in our participants tab. Just to make sure, in case folks out there don't know how to raise their virtual hand, at the bottom of your Zoom screen, you'll see a bunch of different tabs. One of those tabs is called your reactions tab. So if you click on your reactions tab, up comes a couple of different emojis, and one of them is a function that says raise hand. You click on that. We will see your raised hand come in, and we're going to go ahead and take raised hands in the order in which they come. And so everybody knows I'll go ahead and unmute you when it's your turn, and therefore we will make sure that you can ask your question of Dr. Lome. And with that, I think we're ready to go. So if you're ready, Doctor, I'll bring in our first. Excellent. Thank you. So up first, I see we have Joel A. Joel, I'm going to unmute you now. Hi, Joel. Welcome.
Thank you very much. Dr. Lome, that was an absolutely fantastic presentation. I think it was just great.
Thank you.
The question I have is this. There's so much information out there now about reversing heart disease, and much of it focuses on things like healing endothelial cells. It focuses on plaque and blockages and the rest of it. My question is, though, is there any information about reversing atrial fibrillation?
Great question. I love it. I love it. So as we get into these question and answers, I just want to say first that every way that I answer questions, it has to be very evidence-based and science-based, of course. So I will say when there is a strong amount of evidence that suggests something. I'll say when we don't have solid evidence, randomized controlled trials that can give us a good conclusion, but we kind of would think that this might be the case, et cetera. And then I'll say, listen, we don't know the answer to that. That's the third possible option. And it's important to understand that because a lot of times people ask questions that we just don't know the answer to, or the science hasn't been done. We could speculate things, but we don't want to speculate because they used to speculate the earth was flat and, clearly it's not. So we really need to avoid speculation. So we really want to give answers that really are science-based, based on what randomized controlled trials have shown, what good, well-done observational or epidemiologic research has shown and concluded. And the unfortunate truth is that there are many, many things in our whole world that the research hasn't been done because there's no money behind it to fund that type of research. The broccoli industry doesn't pay for research to randomize controlled studies on broccoli to see if it does this or that or whatever. So there's just a lot of instances where I'll say, we would think this is our speculation, but we haven't really been able to show in clinical trials. So now that's the preface. So about atrial fibrillation, what I would say is we know that the primary driving force behind the development of atrial fibrillation, which is a fast, irregular heartbeat that comes from the top of the heart, it significantly increases the risk of stroke in people. It could be very annoying, obviously, symptom-wise, and take a lot of medications to control. There's ablations and things that can treat it and such. But in regards to reversing it, there is no good clinical trials besides some that show that weight loss. It focused on weight loss. It didn't say how you lost weight. It just said weight loss. Weight loss dramatically reduced recurrent episodes of atrial fibrillation. And it's in the guidelines. The ACC-AHA guidelines for the treatment of atrial fibrillation give a class 1 indication, strong level of evidence for weight loss in patients with atrial fibrillation that comes and goes in order to prevent recurrences of atrial fibrillation. So having said that, now that's what the science has shown pretty strongly, is that it's focused on weight loss, not specific foods as much. You can question whether or not certain things can worsen it. There's really questions about fish oil and things and increasing risk and such. But an interesting, when you're just trying to speculate, how powerful could prevention of atrial fibrillation be with the lifestyle medicine approach? So I gave a talk. It was in Central Illinois, 3 years or so ago. And there was a professor from Loyola University where I trained at who was talking all about atrial fibrillation just after me. So I gave a whole big presentation on reversing heart disease and lifestyle to all these cardiac rehab people. And then he got up and he gave his whole atrial fibrillation about, medicines and ablation. And I just had to ask the question, raise my hand and say, hey, you heard my lecture. I'm all about prevention and lifestyle medicine and all that stuff. Just curious. I know the data might not be out there, but what do you think? What percentage of atrial fibrillation do you think is preventable through diet and lifestyle? And he said at least 90%. At least 90% is preventable. That was his answer, not based on super solid science, but just based on his experience. Sleep apnea is a big cause. Sleep apnea is worse when people are overweight. And if you want to hear a story of somebody who personally reversed their atrial fibrillation, or at least has, put it in regression or made it go away, Dr. Jim Loomis is a pretty well-known plant-based doctor. I believe he's in internal medicine, works at Barnard Medical Center. He was in the Game Changers documentary. He tells a story on some podcasts how he had atrial fibrillation, and when he went on a plant-based diet, lost weight. He hasn't had it since then. He's done Ironman triathlons and everything since. So reversing it is predominantly, the science has shown weight loss. Besides weight loss, there's not much else that has been very well definitively shown, but you'd speculate that if you decrease inflammation everywhere through the proper diet, it would help as well. Long answer, sorry.
Not at all. We're so glad to have all of that. Thank you so much, Doctor. And up next, we have Linda S. I'm going to unmute you. Hi, Linda. Welcome.
Thank you so much. My question is simple. What is your opinion about consuming nuts, seeds, and avocados for heart health or arterial health?
Awesome. Another great question. And this is something that for any of those that follow a lot of the YouTube debates and stuff that goes out there, this has gone back and forth and back and forth. Whenever I get a question that's like this, I always start by saying that in the big picture, we need to remember that these nuances, while they're important, I'm not downplaying the question, in the big picture of things in the health of America, the problem with America is not consuming too much nuts. It's consuming too much processed foods and animal-based foods. So while we debate and spend a lot of time and effort trying to tease out these different things within the plant-based diet realm, what's winning is cookies and candy bars and soda pop and animal-based food. So we should, as lifestyle medicine practitioners and such, focus our energy on the bigger picture, in my opinion. But then, getting into the nitty gritty, once somebody's already made the change and they've already eliminated the processed foods and the animal-based foods, and now they want to know, how do I optimize and tweak things in order to be as ideal as possible? Questions like this are very valid. And so what we know is once you developed heart disease, especially severe heart disease, where you have no choice, there's no other procedures that can be done, you're having symptoms a lot, that Dr. Esselstyn's clinical trial excluded high-fat plant-based foods, which included nuts, seeds, avocado, coconut, and most soy. He allowed a little bit of low-fat tofu, and he had dramatically good results with that. It wasn't perfectly designed studies. It wasn't randomized controlled. It was, observational. So there's, not the greatest studies, but Dean Ornish's study in heart disease reversal, which I showed some slides on, did include just a smidgen teeniest bit, but he wanted to keep percentage of calories from fat to 10% or less. And that's almost impossible to do if you eat significant nuts and seeds. So when people have heart disease already, we know that the reversal trials have shown that it should be excluded. Now, did they have an arm where they had more nuts and seeds in it? No, they didn't have that arm. So is it possible that people can tolerate more? Well, maybe. Similar to the question about oils, and can some people tolerate oils and which oil is healthier? Well, if your LDL is under 70, if you're at your ideal body weight, if you don't have elevated inflammatory markers, then probably the amount of nuts or seeds that you're consuming isn't causing any significant damage to you. And in healthy people who don't have heart disease, they could probably be a little bit, consume a little bit more nuts and seeds, in my opinion. It's not going to really dramatically increase the risk of heart disease development, especially, again, if your LDL cholesterol remains low, because there is some saturated fats in nuts and seeds. And as long as your inflammatory markers are fine and you're at a nice ideal body weight, staying physically active, go ahead and consume those nuts and seeds. One of the things we worry about is don't go nuts on the nuts. They're very addictive. And once you start knowing the fat taste, then you might be more prone to eating other fats that aren't good, oils and, God forbid, animal-based fats. So it takes a strong willpowered person to be able to really tune their diet in that much of a degree, but some people can do it. So to summarize all that, severe heart disease should be dramatically restricted, if not eliminated. If you're healthy, small amounts are okay, but don't go too crazy with it. And then when I have somebody who is just struggling with diet in general, just struggling to go more plant-based, and they need a lot of nuts and seeds, according to them, at first, in order to just ditch the processed foods and the animal-based foods more, I'm not going to restrict them. I'm going to say, go ahead, do it. Have as many nuts and seeds as you want. Go crazy. It's harder to lose weight. There's saturated fat in there. It might not be ideal, but it's better than eating animal-based proteins, and it's better than eating processed fats. So eventually, as we get you off the animal-based foods and the processed fats, we can slowly wean down your nuts and seeds. So I do have many people who we take that approach in initially until we finally get them more optimized.
Thank you, doctor, for that. Up next, I have Thomas A. Thomas, I'm going to unmute you. Hi, Thomas, welcome.
Oh, thank you. Dr. Lome, love your presentation. Let me just give you a little background. In 1987, I worked in a blood bank, and there was two gentlemen that came in that donated blood altruistically. It wasn't for pay. And after a few hours, I saw the blood in the refrigerator, and it had it precipitated without centrifuging to a battleship gray that was on the surface of the bag of blood. And my question is, it was battleship gray. And that was just after they had mentioned they just went for McDonald's for lunch. Is it that profound? That's my question, just from one meal. And secondly, if one stays away from any saturated fat, how long is the reversal process? Because this battleship gray looked pretty awful.
Yeah.
And that was 1987. I thought by not eating at McDonald's, I was safe. I didn't realize it was saturated fat. Well, anyway, that's my question.
Yeah, so great question. So a lot of times, I'm not a hematologist or a pathologist. Pathologists are experts in doing all the lab testing and such. But what I do know is that triglycerides, one type of fat, and saturated fats, I mean, that's kind of what causes that cloudiness that you saw that picture from the Game Changers. And just that Game Changers picture is just kind of shows it that any type of fat in the diet, even just one meal, is going to cause that cloudy appearance. And it's a little variable from person to person. If you were to analyze that blood and see the triglyceride levels and see the cholesterol levels, that's going to directly correlate with the visual appearance of the blood. So, I've had some patients who have triglycerides in the 1,000, 2,000, 3,000 range, which is insane. Can cause, not just heart disease, but it can inflame the pancreas and do these other things too. When they get their blood drawn, it literally comes out white. They have white blood. It's pure fat coming out of their veins. It's really crazy to think. And yeah, one meal can do that. And so it's very true. So that's probably exactly what you're seeing. In regards to how long does the heart disease reversal process take? That is a question that's a challenge to answer. And one of the things that frustrates me about why we in our healthcare system have not really taken this more seriously and done more research since 1990 when Dean Ornish published his lifestyle heart trial. We don't have a great answer. After 5 years, there was, I think it was an average of 11% regression of severe stenosis on Dean Ornish's trial. Pritikin reportedly was following his lifestyle for a couple decades or so, and his autopsy didn't show any severe stenosis, but the criticism of that was he never had an angiogram. He just had exertional chest pain with an EKG that showed it was abnormal. So who knows, right? The general thought is that it takes decades to completely reverse because it took decades to build up. And what I always say is, because you can argue, how do you define reversal? What do you call reversal? Is it really reversed? Back and forth. But the most important thing to think about is not the percentage of blockage that's there. It's two things. How does the patient feel? Are they having any symptoms related to heart disease? And number two, did they have an event? Did they have a heart attack? Did they have a stroke? Did they need a stent? Did they need a bypass? And the research is extraordinarily clear that following a healthy lifestyle, including whole food, plant-based nutrition, especially that's low in fat, dramatically reduces cardiovascular events, heart attack, strokes, the need for revascularization procedures. And the longer you're on it, the better you do. The first few years, there's still some what we call residual risk because, you knocked the inflammation out good. You started the healing process and the reversal process, but there's still a lot of plaque that could still be a little bit vulnerable. So say you've been on it for 2 years, you're doing good, you think you're fine. Bam, you get the flu, you get COVID, the whole body gets inflamed. A plaque can destabilize and still trigger a heart attack and stroke. So I don't like to say that this makes you heart attack proof, like some people use that term. That's a little bit of a strong term. It can dramatically reduce your risk to a very low level, but not quite zero. But the longer you've been doing it and the longer you've been able to maintain it, the better you're going to be. And probably that magic is 5 years. Once you've been on it for 5 years, if you've had no event and no major issue, you're very unlikely to, as long as you stick to it.
Thanks very much for that, Doctor. We have another question now coming in from Randy C. Randy, I'm going to go ahead and unmute you. Hi, Randy.
Hi, a great presentation. I wish I'd known all this when I raised my 6 children, but one's plant-based so far. But anyways, can ED be reversed for a man that's been on plant-based now for 2 years?
Great question as well. You guys are all lining up with the big good questions, all the good ones. Can erectile dysfunction be reversed for somebody who's been on a plant-based diet already for 2 years? Well, we know that erectile dysfunction is mostly reversible. So 90% or so of it is vascular related. There are other causes of erectile dysfunction. So if you're talking about vasculogenic type erectile dysfunction, it has to do with decreased blood flow to the penis. So sorry, guys, you have a small penile artery, but you do. Penile arteries are very small compared to coronary arteries or brain arteries. And it's very frequently the first artery that shows any symptoms or any clinical manifestation that there's dysfunction in your circulation. So and they always say that erectile dysfunction is a canary in the coal mine. A man develops erectile dysfunction 2 to 5 years or so before heart disease hits them. And we should consider men with erectile dysfunction as heart disease patients until proven otherwise. It's called a heart disease risk equivalent. So having said that, one of my last YouTube videos was all about erectile dysfunction, featuring that scene in The Game Changers where they just gave these young athletes one meal that was healthy one night, one meal that was unhealthy the next night, compared their erections while they slept, and the difference was dramatic. It was hilarious. Make sure everybody checks out The Game Changers and sees that scene, or at least watches my video on YouTube. Now, getting into more detail, if somebody has been following it for 2 years, my question is their LDL less than 70? Are their inflammatory markers negative? Are they doing other things like secondhand smoke exposure, tobacco exposure? Do they have other things like lipoprotein little a elevation, some of the other nuances that might be there? So if they aren't doing really good with those other things, especially with that LDL cholesterol and protecting the endothelium from other forms of injury, then you're not quite exactly doing the perfect approach to reversal of any type of vascular disease. And then getting back to what I said in the last go around, it does take time sometimes, right? How occluded was that penile artery to begin with? The longer somebody sticks to it, the better they're going to be. And so some people can reverse it really quick, like that nuclear stress test that I showed in the Dean Order studies, that within 3 weeks, the blood flow improved dramatically. That situation was somebody was very sensitive to it. The inflammation knocked down, the little microvasculature opened up, and the blood flow improved. But had that person had a 99% blockage or nearly 100%, you wouldn't have seen that effect in 3 weeks. It would have taken a lot longer. And so if the erectile dysfunction has already progressed to a very severe degree and the circulation is already profoundly decreased, it's going to take longer. So sticking to it for much longer, keeping the LDL level nice and low, at least under 70, maybe even around 50 would be better, and protect the endothelium from damage and just give it time. And if it's still not working, see a urologist about other non-vascular related causes of erectile dysfunction.
Thanks very much for that, Doctor. Up next, we have Stephen V. Stephen, I'm going to unmute you. Hi, Stephen.
Hi, and thank you for an excellent presentation. It was really world class.
Thanks.
I've been plant-based for about a decade.
Awesome.
And the lowest I've gotten, my total cholesterol has been around 154. And more typically, it's 180. And the LDL, the lowest it's ever been is 90. I'm pretty good with the diet, and my weight's good. And I've really worked the diet, the exercise, the sleep, everything. I do eat some nuts, some flax seeds, some walnuts, but not a lot. But I would say my total fats probably come in around 25%, not 10%. At what point do you think about a low dose statin just to drive things down to an ideal level?
Well, so I would first ask the question, again, another great question. And I get this question a lot too. And I have, I think 3 patients that are kind of in this scenario. But the first question is, do you have heart disease or not? Because it's kind of a different mindset, primary prevention versus secondary prevention. In a primary prevention patient who's been healthy and does not have any documented vascular disease and never had a heart attack, stroke, a stent, an aneurysm, one of those things, then, having an LDL cholesterol around the 80 or 90 mark with the total in the 150 to 180, as long as you're doing everything else right to protect your endothelium from injury, it's not going to be a devastating thing. Now, if it was secondary prevention, like somebody's already had an event, a heart attack, a stroke, a clog, something that happened, then it would be very important to try to get that LDL cholesterol down at least less than 70, and depending on your age, many experts think less, in the 50 range. Now, one thing you could think about is doing a more advanced lipid profile. There's Boston Heart, Cleveland Heart, Berkeley Heart Labs that will do some other analysis for you, which can help you to make a decision regarding how aggressive you want to be. In regards to, like, they'll check something called lipoprotein (a). If that's normal, you're in better shape. Apolipoprotein B, many people think, is a better marker for cardiovascular disease risk than the LDL cholesterol is. We may see a day where all of our guidelines shift away from LDL cholesterol and shift more towards apolipoprotein B. It's not there yet. So if you check those advanced markers and your apolipoprotein B is normal, even though your LDL is a little up, you're probably okay. And again, as long as those other things such as lipoprotein (a) is fine. And the last thing you can do, if it's a primary prevention situation and you never had an issue, is to get what we call a coronary calcium score. It is a very low dose CT scan, no IV need. It takes 5 seconds. I did it myself. And it can determine, do you have plaque buildup that's already calcified that's there? And the more calcified plaque you have in the coronary arteries, the higher your risk is going to be. If you have a lot of calcified plaque already, even if it's primary prevention, you might be like, oh, I should do whatever I can to try to get the LDL cholesterol down. Now, there's other also natural things you could try. There is some good data, and I recommend you check out nutritionfacts.org on AMLA, Indian gooseberry. You could add that into your diet. It might drive your LDL a little bit further. There are some other things you can play around with. There's something called the portfolio diet, which is a little tweak of a plant-based diet where there's more soy products in there and more phyto sterols that can help drive the cholesterol numbers down. So some people say in this scenario, you should check out those things and try to tweak it that way. But yeah, those additional calories from fat that you have will, to some degree, raise your LDL up. Now, I've been doing this whole lifestyle medicine thing and heart disease prevention and reversal for about pushing 6 years now. Not a long time compared to the Esselstyns of the world and the Dean Ornishes and the Neil Barnards and Kim Williams. So I have actually leaned on their expertise quite a bit, and I've asked them this question myself because I want to know how to answer it, because I get this question a lot. And so what the two best answers that I had from them, one was Caldwell Esselstyn. He said, listen, if you're doing everything else perfectly and you know that you're whole food, plant-based, no oil, and he wants you nuts, seeds, avocado, coconut removed from your diet to higher fat plant food. So he wants you around that 10% mark. If you're doing everything you can and your LDL is still a little bit high, don't worry about it. You're protecting your endothelium, you're going to be fine. That was his answer. And Neil Barnard's answer was, hey, yeah, some people's LDLs are still high, even though they're perfect. And just give it more time. Slowly over time, his answer was it should slowly creep down over, kind of as the plaque regresses, then it should slowly come down. And I forget if you mentioned or not, whether or not you're at ideal body weight, because every pound of body weight, the LDL tends to come down by about 1 point on average in population-based studies. So if you're above ideal body weight, losing that weight is also a way that you can get the LDL number down just a little bit further. So,
thank you very, very much for that, Dr. Lome. And up next, we have Stephanie P. I'm going to unmute you. Hi, Stephanie. Welcome.
Hi, Dr. Stephen. Thank you for doing this. While you were doing your presentation, I was inspired to go look at my charts and see if anything was alarming. Can you just tell me if anything I should be concerned about? Cholesterol 220, HDL 111, LDL 93, and triglycerides 80. Is any of that scary?
a little bit. So what I would say is the triglycerides are great. That's awesome. We usually, in a perfect world, we'd like the total cholesterol under 150, the LDL under 70. But you have an interesting scenario, which I also see relatively commonly, where the HDL is very high, 110 is very high. It is more common in elite athletes. It can happen with liver problems sometimes as well. In young women, the effects of estrogen, the HDL goes up. And I think, what you want to really try to do, get the cholesterol LDL down by reducing cholesterol saturated fat, making sure your weight's near ideal as best as you can. And then this whole HDL thing, if a doctor ever tells you you're fine because your HDL is high, they're wrong. That's not right. So a lot of historically, we've always said, oh, HDL is the good cholesterol, it's healthy. I used to tell people HDL healthy high. You want it high, all the H's, you always remember that. LDL lethal low, you want the LDL low. But what more and more research has really shown is that raising the HDL super high is not necessarily a good thing. HDL cholesterol is still cholesterol. It still can contribute to the atherosclerotic process, not as much to the same degree as LDL cholesterol, no question. It's, we always talk about HDL does reverse cholesterol transport, brings cholesterol from the organs to the liver, process it, and then literally goes through your bile into your intestines and you poop it out. So I remember writing an article once saying, poop out your heart disease, because that's really what happens is you literally excrete it in your bile and you poop it out. So you're pooping out your heart disease if you're reversing it. That's where it goes, right? Anyways, so there were lots of different therapies that artificially raised HDL cholesterol. Niacin can raise HDL cholesterol, did not prevent heart attacks or strokes, did not improve mortality, no longer recommended by the American Heart Association, American College of Cardiology for the prevention of cardiovascular disease. Pfizer did a study on a drug called torcetrapib, which they developed to block a specific pathway in the cholesterol metabolism. And it could double, triple, and some people even quadruple the HDL cholesterol. So it can knock people's HDLs up to 110, 120, 130. And they're like, this is great. You're going to have all this healthy HDL cholesterol. We are going to reverse all this heart disease. What if this is the cure for heart disease? And guess what happened in the clinical trials as they're trying to get FDA approval? Didn't prevent heart attacks, didn't prevent heart disease, increased stroke risk, never became FDA approved. Pfizer lost $1 billion with a B dollars and abandoned their whole cardiovascular drug research section of their company. So raising HDL is not thought to be what we want to do. There is some interesting other anecdotes that kind of go along with that, some other science, that there's a mutation in HDL called the ApoB Milano lipoprotein, which was discovered in this family in Italy, where they had this really low HDL in 20 to 30 range, but they never developed atherosclerotic heart disease at all, even though their HDL was low. And so researchers analyzed it, they found this mutation, and they found that it was an extraordinarily efficient HDL, but the number was low. They measured what's called the efflux capacity, the capacity of each individual HDL molecule to do its job in the reverse cholesterol transport. There's a really good published study in the New England Journal of Medicine that kind of goes over this. And they had an extraordinarily high efflux capacity in their HDL. So what do the researchers do? Oh, let's take this HDL and infuse it into people intravenously. So they grow it in the lab. It was extraordinarily expensive, something like $10,000 a dose. They infuse it into people. They did angiograms and showed reversal of atherosclerotic heart disease. Isn't this crazy? I remember when I was doing a rotation at Northwestern University of Chicago, they did a journal club and presented this data. And it was like, oh, this is great. But what's happened to this subsequently? Well, it was Pfizer. They abandoned their drug, their cardiovascular drug thing. They sold it to some place in China who went bankrupt, who sold it to some place in Canada who wanted to grow it in corn and then try to infuse it into people. Never happened. So, but it was all the HDL Milano, that super efficient HDL that was supposedly going to reverse heart disease. And so what you really need to think about is not the number of your HDL. And don't let a doctor tell you because your HDL is high, it's okay if your LDL is high. No, you need the efflux capacity, which I know Cleveland Heart Labs is working on getting a test that you can actually measure that. I'm not sure if they're there yet. I haven't seen it. But I would be concerned your total is too high, your LDL is too high. You want to get those numbers down by reducing cholesterol and saturated fat dramatically. And don't ever let somebody tell you because your HDL is that high that you're protected. You're not.
Doctor, thank you. Thank you so much for all of this. Just valuable for all of us. I am going to bring in our next question. I hope I'm pronouncing your name correctly. I'm going to unmute. Is it Anatina? Welcome.
Thank you so much. Yes, it's Anatina, plant-based since 1974 and psychiatrist. But I do treat all kinds of people. So I have a young man, 44 years old, who came down with a terrible case of cirrhosis. Mostly alcohol due, but he's sober now over a year. And I got him to be plant-based over 1 year. And everything looks good. And there is a question to you, is in your experience, or have you heard of any cirrhosis reversal?
Wow. Well, that's a great question. And, of course, I don't treat liver disease patients, so I don't have a great amount of experience with this. So I don't know if I'm going to give you the best answer, but I would say that we know fatty liver can cause cirrhosis. Fatty liver is predominantly dietary related, especially in uncontrolled diabetics, patients with high triglycerides. Fatty liver is at least thought to be partially reversible through the proper dietary changes and weight loss, including a plant-based diet. But alcoholic liver disease, I actually don't know of any studies or any published data that shows that alcoholic liver disease is reversible through lifestyle changes. They always say the liver is an amazing organ, that it has some crazy natural way of being able to regenerate and such. But my experience, I don't really haven't had that experience where somebody with alcoholic cirrhosis has been able to reverse it through dietary changes. I've seen kidney disease reverse. I've seen autoimmune diseases reverse for sure. And I think I've seen, it's harder to know, early cognitive impairment, early stage Alzheimer's, improve, stabilize, even reverse. All that's more challenging. But liver disease from alcoholic cirrhosis or full out cirrhosis, I haven't seen it. I've seen fatty liver not causing cirrhosis, but just fatty liver itself. I've seen that go away.
Thank you, doctor. We appreciate your candor on that. I'm going to move on now to Dr. Linda. I'm going to unmute. Actually, Doctor, I'm going to ask you to unmute. If you can unmute yourself. Let's see if that worked. And there we are. Hi, Dr. Linda.
Hello.
Hi.
Hello.
Hi. Okay, so I'm 55-year-old African-American female, lupus, 3 brain aneurysms, 3 successful brain surgeries, hypertension under control with Norvasc, dead pituitary gland, presently about 115 pounds overweight, total cholesterol 230, LDL 143. And so my question is, I want to reverse lupus, I want to lose weight, and I want to have overall awesome health. How do I get started on this wonderful plant-based diet? Because I'm in Mississippi where they don't have nothing but killer food.
I love your energy. I love your energy. I love your enthusiasm.
All right. Thank you.
And whenever I hear that, and I hear that excitement in a person's voice, I automatically have a high degree of confidence that you're going to be successful. The fact that you're here watching a talk like this, you've thought this through, you've made the decision, and most of the time making the decision to make the change is the most important thing to do. But you're right, execution is a big challenge. What I would say is education, learn, and that's what you're doing here is super important. But the other things, it's not just learning the science behind why it works. That's very helpful, and knowing that helps to keep you motivated. But it's making sure that you're set up in your home environment to be successful, making sure that everybody else in your household understands your desire, your health situation, and they need to be on board too. Whether they do it completely with you or not, or just support you, keep the processed foods out of the house, keep the animal foods as far away as possible, and then have them, cook some stuff with you and just learn it together. That's always a big, huge thing to do, because if you go home and there's unhealthy food there, it's ultimately stress is going to hit you, willpower will fail. You need to set up your lifestyle, your home environment. It's got to be a complete lifestyle change. I would say in regards to education, Dr. Brooke Goldner wrote a great book called Goodbye Lupus that you can check out. I've met her before. She's very passionate. There's a documentary, Eating You Alive, where she tells her story, eatingyoualive.com. It's lupus is indeed very much could be treated through plant-based diet and lifestyle changes. In regards to your cardiovascular risk with those cholesterol numbers, you're higher than the average American with that LDL cholesterol. So you're going to be, especially over time, the longer you have those LDL cholesterols up, the higher the risk is going to be. So honestly, each person's different. Your question came down to, how do I do this? Where do I start? And I gave you some tips, but one of the other things I tell patients frequently is just start eating plant-based. You don't think, I can't have this, I can't have that. What about this, that, whatever. If you're using only willpower, that's not the right approach. Keep educating yourself, keep trying to set up your environment the right way, but just find some recipes and start making them and just start eating them. And if you start eating more unprocessed plant-based foods by default, you'll be eating less processed foods and less animal-based foods. And again, like I said, towards the end of my talk, if I have a patient that's very highly motivated that knows they need to get rid of the animal foods and processed foods from the diet, particularly animal foods, watch the Dominion on YouTube. Once you see what happens in animals, you can't unsee it. There's also another good documentary that is on Tubi TV called The Invisible Vegan, which is all about being vegan in the African-American community. And it's really great. It's really well done. And, in regards to hypertension, watch some videos of Dr. Kim Williams. That guy inspires me over and over again. He's an African-American cardiologist, past president of the ACC, so genuine, so smart. He could perhaps motivate you and inspire you as well. Find local support groups. There are almost everywhere you're in Mississippi. I know it's probably not as many plant-based people local to you, but there are online support groups. The Facebook group for Forks Over Knives is phenomenal. I don't forget how many, there's hundreds of thousands of people on there. They'll help you out. Ask a simple question. How do I give up cheese? How do I do this? How do you make this taste good? You'll get like hundreds of responses. It's just such a great community. And in regards to other resources, pbnm.org, click on resources. There's food delivery services, podcasts, there's vacations you can take, like go on a cruise where it's all plant-based, you have no choice. Think about if you have the resources, going to True North Health Center or doing a live-in program to get you going and get you educated. But don't give up. Don't give up. I could tell by the enthusiasm that you have and the fact that you're here, you're going to do it. And I have confidence that you'll do it.
Thank you so much, Doctor. That's really, really meaningful. Up next, we've got Juliet W. Juliet, I'm going to unmute you now. Welcome, Juliet.
Hi. I was told that I have high lipoprotein A and B, and I'm mostly plant-based. I have Hashimoto's, so sometimes I use some collagen protein. I don't know. Do I have to give up eating nuts and avocado olives completely with the high lipoprotein A and B?
Yeah, what's your LDL?
It is, let me see, my last test is 145.
Yeah, that's kind of high. That's kind of high. So what I would say is, first of all, most of heart disease can be summed up with the LDL cholesterol and the endothelial injury. But the nuances of the lipoprotein little a, lipoprotein B, these other things, they're important and they should be thought about. If they're elevated, it's going to increase your risk. Lipoprotein little a is a challenge. Dr. Baxter Montgomery did a good trial of patients with elevated lipoprotein little a, putting them on a plant-based diet and measuring the change. It reduced it by 15% in about a month or two, which is okay. But if the lipoprotein little a is 300 and we like it less than 75, 15% reduction is not going to get you there. 15% reduction will get you down to like, whatever, 250 or so, but not down to that less than 75. It's the same thing with niacin. Niacin isn't recommended, but it does lower lipoprotein little a little bit. But the reason it's not recommended in those patients is that it doesn't lower it profoundly enough to make a significant impact on cardiovascular disease risk. Right now, we don't have any great therapy for elevated lipoprotein little a. What we tell people is focus on the LDL, don't smoke, eat healthy, exercise, and protect your endothelium at all costs, and just do everything else that you could possibly do. And if you can do everything else the right way, then hopefully you're going to be in good shape in the long run. So I would say work on getting the LDL down by reducing cholesterol and saturated fat. I am not aware of any science either about collagen and Hashimoto's. I just had to say that. I'm pretty sure that's not something that's recommended by any scientific study or any major organization, but I may be wrong. I'm not an endocrinologist. It's focused on the LDL, focused on protecting your endothelium, and by asking about the avocados and other plant-based foods, reducing them will reduce your LDL a little bit, but just make sure there's no animal foods, no refined oils, and hopefully things will be okay.
Again, thanks so much for that, Dr. Lome. Up next, we have Denise R. Denise, I'm going to unmute you. Let's try that. Hi, Denise. Oh, hang on, Denise. I'm sorry. Wait. Let's try that again. Denise, hello.
Hello, can you hear me?
We got you now. Thank you.
Thank you. And thank you for this great presentation. I would just like to follow up on an issue that's been talked a lot about. I'm sorry if you talked about it before the Q&A. I just came in late. And that is protecting the endothelium and the oil issue. My first learning about the endothelium was with Dr. Esselstyn, and I actually wrote down 1 drop of oil will destroy your endothelium, never do that. And then, of course, and I understand the patients he was working with, extremely sick people sent home to die. But then, the years have gone by, and then that there are, it seems that some cardiologists and some other plant-based docs have a little bit of a different take on that, particularly with olive oil and avocado oil, because it's low in saturated fat. So partly what I'm trying to get, and I actually heard Dr. Williams recently in a being in an interview say, even a guy like him, he uses a little olive oil because he's so active and he needs calories and blah, blah, blah. So I'm trying to understand, it's so hard for me. It's like, is it really 1 drop is going to destroy your endothelium, or is it just a more? Because in my house, we are whole food plant-based, normal weight. But my husband did have elevated LDL around 125, 130 with a C score of 94 on the left, nothing on the right. Little a was normal, but I did notice that he had an elevated heart CRP. And so we just put him on Zetia because he couldn't do a statin. But I really, I'm just trying to understand better this issue of will 1 drop of oil destroy? Because we have, these other cardiologists saying a little bit of oil is not a problem. We have the Sharzais, so if you could talk about that.
Yeah, no, great question. I didn't address it in extreme detail in my presentation, but I would say that I do have a 17-minute YouTube video just talking about oil. And to try to keep my answer shorter than 17 minutes, what I'll say is, first of all, focus on oil, and second of all, a little bit on your husband's situation. That we do know that oils are very highly processed, they're very calorie dense. So what I concluded, through my opinion and research and experience, attending all these conferences, talking to all these experts, is really, there's individual variability. Some people can tolerate some, and some people can't. So it's similar to smoking cigarettes. You don't need to smoke to live. You don't need to consume any oil to live. You need fats, but you can get fats from unprocessed plant-based foods, right? And so how much smoking can you tolerate before it causes damage that's significant enough? Well, everybody's different. How much oil can you tolerate? So what I would always say is, if your LDL is under 70, that's the key, right? So even olive oil is 15% saturated fat. And even the saturated fat in olive oil will raise your LDL cholesterol. So that right there, if somebody's LDL is over 70, it is a sign that, hey, maybe you need to cut it out. And then I always say, you got your ideal body weight, because it's very calorie dense and will lead to weight gain. And so if you are not at ideal body weight, then cutting out the oils, even olive oil, would be beneficial. And then if you watch the end of that video, I do comment on the inflammatory markers, because almost all oils are high in omega-6s, especially compared to omega-3s, and the ratio is really thrown off. And so they can be pro-inflammatory. And so if you want to make sure your omega-3 to omega-6 ratio is adequate, we evolved of a more close to a 1-to-1 ratio, then cutting out the animal foods and the processed oils are important. So Dr. Esselstyn, I attended his course as well over in Cleveland, just for, my own educational purposes, to learn what he he tells his patients. And I do know that one of the reasons he says not a drop of oil, one of them is because he doesn't want you to be addicted to the fat taste. And even if you have just a little bit, it's going to be a little bit more and a little bit more, and then a little bit of nuts and a little bit of seeds, a little avocado sneaks in there, and this gets snowballs out of control. The heart disease reversal is percentage of calories from fat at 10% or less. So he didn't want a single drop of oil anywhere in the diet to keep people away from other fats as well. And he would say, you know, there's some endothelial studies, the brachial artery tourniquet, that would show that many different types of oils can cause dysfunction. And for the people who say, what about this research study and that research study that shows that olive oil reduces risk, it is almost always what we call a substitutionary benefit. So what that means is if you substitute animal fat, saturated fats from animal sources for olive oil fats, which is lower in saturated fat, you're going to have a benefit, right? You're going to have less heart attacks and less strokes, and it's going to make it look like olive oil is good for you. And essentially every single study that has shown olive oil is good for you, it's always been a substitutionary benefit where they remove the animal fats and add the olive oil, right? And, you know, the analogy I use for that is it's kind of like saying, let's do a research study and compare cyanide to arsenic. Let's give people cyanide and arsenic and let's see what happens, right? Oh my gosh. The people who get all the cyanide, they die real quick. And people who get the arsenic, they don't die so fast. Maybe arsenic is good for you. Let's all eat arsenic, right? Well, no, it's not good for you. It's less harmful than cyanide, right? That doesn't mean it's healthy for you. Just because it's less harmful doesn't make it healthy. And so the only way to really answer the question with a high degree of confidence would be to take people who are whole food, plant-based, no oil, add the olive oil, follow them over time, follow their markers and see who has events. And of course, that study hasn't been done, which is why this question is asked a lot. People don't really know the answer and there's differences of opinions. So I always say when you want to be very aggressive, restricting the oil is important if your LDL is over 70, if your inflammatory markers are high, if you're not at ideal body weights. You know, if having a little olive oil, similar to the nuts and seeds answer, if having a little bit of olive oil in your diet helps you to maintain the more plant-based diet in the long run and helps to avoid animal-based foods and processed foods, is it devastating? It's probably not devastating. And many people can tolerate the olive oil and canola oils, low in saturated fat as well. And people question about, you know, flax seed oil because of the omega-3s and everything. You know, it's a hard question to answer with a high degree of confidence. But if all the parameters are not normal that I mentioned, I would still avoid it as much as you can.
Dr. Lome, thank you so much for that. Again, just you very gracious with all of your time and your answers. I'm going to go ahead and move on. We've got another question here from Bob S. Bob, I am unmuting you. Hi, Bob.
Thanks, Ben. Hi, Ben. Thank you, Doctor. It was a great presentation.
Thank you.
You just answered some of my questions about olive oil and flax oil, because I know there are a lot of health advocates and vegan doctors and vegan nutritionists who actually recommend it, but you explained your thoughts on it, so that was great. My situation, I have to say, I'm very frustrated, and it's very disconcerting for me. I had been a lacto-ovo vegetarian for about 30 years. I added fish in for about 20 years. I'm 74 years old. So I've known about a lot of this stuff for years and years and years and got some mixed messages. And my weight is great. I weigh about 140. I was always exercising, never smoked, never drank. Last year, I had 4 stents put in. That was devastating, I have to say. Yes, my LDLs were high at the time. Yes, my cholesterol was high at the time. I was eating a fairly good diet. I would say plant-based for the most part, but I went off here and there. And I have been on vegan regimes like for maybe 1 or 2 months at a time and so forth. That was difficult to understand. Now, I also have been on an antidepressant for 25 years. And I suspect I'm genetically predisposed. But I feel, and you probably feel the same way, you can kind of overcome that predisposition. Both my parents had high cholesterol. They did not have heart disease, though. Neither one of them, but they both had high cholesterol. Again, in my situation, I always felt I was living a healthy lifestyle. And then I got angina. I was playing pickleball, and I got pains. And as I said, last year it was 4 stents. Now, let me get to this part. This is the good part. I went to an integrative cardiologist on Zoom, a 6-month heart healthy lifestyle based on Cleveland Clinic. The Renew Food Plan, Institute for Functional Medicine at the Cleveland Clinic, low carbohydrate, because she was concerned about high sugar, which can contribute to heart disease as well. So I've been on that for 5 months. My LDLs went down about 90 points, same thing with cholesterol, 100 or 90 points. Yet, they're still high. And about a month ago, 2 of the arteries clogged. And at this point, I'm trying to recover from that. And so my cholesterol at the highest, it was 297. After that 5-month program, it went down to 211. My LDLs went from 247 to 154. Yes, my regular cardiologist who put the stents in wants me to get it down to 50. I was on statins during that 1-year period. It got down to 70, but I had so many side effects from it, I had to go off it. So I was off it. I was off all the other medication except for the aspirin. And then this happens, the 2 clogged arteries. So that is, it's like I'm banging my head against
Well,
the
yeah, so yeah, I
do?
get it. I was banging my head too. I understand. Yeah. If your LDL was over 70 for a long time, the plaque was being laid down for decades and decades and decades. And so it wouldn't be a surprise to me. And I know your parents didn't have clinical heart disease, but almost all people end up developing, plaque buildup by the age of 18. Nearly 100% of people have visible to the naked eye cholesterol plaque. So I'm sure they had some. What I would say though is we need to be science-based and evidence-based. Like I said at the beginning of the Q&A, and there is a lot of criticism of functional medicine, integrative medicine, homeopathic medicine, naturopathic medicine, that they're just not science-based. There is no good published randomized controlled trials to support their recommendations. Yeah, you could put a big name like Cleveland Clinic on it, but it's still, the whole concept of functional medicine is not based on endpoints. Again, they have a lot of physiology that they talk about and insulin resistance, all these things. That's all fine and dandy. But is their approach going to prevent a heart attack and stroke? And the answer is no. The data hasn't shown that a functional medicine approach reduces outcomes for cardiovascular disease. Lifestyle medicine has the evidence. So strong evidence. That's what Dean Ornish does. That's what Caldwell Esselstyn does. That's what all these eating more plant-based, that's a lifestyle medicine approach. So I would ditch your functional medicine specialist, find a lifestyle medicine specialist and listen to what they have to say. People tend to like functional medicine people because they won't try to make it go 100% plant-based. I'll never forget, what's that guy's name? He's at Cleveland Clinic and he just says how he's a functional medicine doctor and he says he loves lamb fat. That's completely against everything I just said in my whole talk, right? Cholesterol, saturated fat, animal-based calories. Yet it's lamb fat is okay to consume on Dr. Mark Hyman, thank you, is okay to consume. No, it's not. It's not an evidence-based approach. Find a lifestyle medicine doctor. Go see Caldwell Esselstyn. He'll talk to you on the phone. He still does that. He just talks to patients randomly. You just go to his website, send him an email, he'll call you. It's crazy. But you really need to take the lifestyle medicine approach. You can reduce your LDL cholesterol down and protect your endothelium simultaneously by ditching you said you're a lacto-ovo-vegetarian, which probably means you were at most 80% plant-based. And every person's different how far they have to go to protect their heart from cardiovascular disease. Some people can get away with that 80% plant-based mark, and they're lucky. Other people need to be 90%. Other people need to be 99% or nearly 100%. In order to make sure that over their lifetime, they don't develop the cardiovascular disease. So at this point, if your LDL is still 150, You need to knock out the cholesterol and the saturated fat to a dramatic degree. You need to be more unprocessed, plant-based as far as you can. And what I really recommend people doing in a scenario like yours is just go all in for 1 month. Pick a day, go crazy, get ready, get your food ready, get your recipes ready. 100% whole food, plant-based, no oil, low fat. Do it for 1 month, then get your numbers checked. See where that LDL goes. And you're gonna be like, oh my gosh, it's 60 or 70. I can't believe it. It's never been this low off medicines. And you're going to find that that's going to just be evidence to yourself that that's what you need to do. That's the approach you need to take. So find a lifestyle medicine doctor and get the percentage of calories in your diet as close to 100% as you can from unprocessed plant-based foods.
There it is, folks. Sage advice from Dr. Stephen Lome, and we so appreciate that. We are up against the clock, everybody, for our next lecture, so we're sorry we couldn't get to every single hand raised, but we sure do appreciate you all being here with us. And Dr. Lome, my goodness, so incredibly valuable, and we really, really appreciate your time and your expertise and everything you share with us today. So meaningful. I know I'm not the only one that wants to thank you, so I'm going to ask my tech team to unmute our entire audience. And what does everybody want to say to Dr. Stephen Lome?